this video, we want to cover the uses of anticoagulants, okay? So, the thing here is, generally, you want to prevent a thrombus, you want to prevent the extension of a thrombus, right? You want to prevent embolic complications, right? So, these are what you want to achieve generally. That is why you give an anticoagulant, correct? Just adding some more information here. Prevent the thrombus, prevent thrombus extension, prevent embolic complications by reducing the rate of fibrin formation. Coming to specifics here, you can use it to treat deep vein thrombosis, pulmonary embolism. Okay? Just telling you the main things here. Then you can add further on each of these. Then in case of myocardial infarction, you want to give it myocardial infarction, right? To remove any blockade or to make the blood not coagulate as much, right? Then moving on, in unstable angina, you want to prescribe this, unstable angina. Then rheumatic heart disease, rheumatic heart disease, like atrial fibrillation, AF. Okay. Where else you want to give? Cerebrovascular disease, correct? Cerebrovascular disease. Are you sleeping? Please wake up if you are sleeping. Now coming to the sixth point, vascular surgery, prosthetic heart valves, retinal vessel thrombosis, extracorporeal circulation, hemodialysis. Whoa, that's really long. Anyways, we'll write it. Can you say vascular surgery? Vascular surgery.
Vascular surgery.
Prosthetic heart valve. Okay, prosthetic heart valves, retinal vessel thrombosis, extracorporeal circulation, hemodialysis. Moving on to the last point, defibrination syndrome. Okay, this is also called as disseminated intravascular coagulation. Okay, like abruption of placenta and other obstetric conditions, certain malignancies, infections, etc. Okay, so what happens in this defibrination syndrome? The coagulation factors, they get consumed for the formation of microclots and blood is incoagulable. The strange thing here is you give heparin and it will control bleeding. It's so strange, right? It preserves the clotting factors and Heparin, it's a paradox here. It preserves clotting factors and hence it will stop the bleeding. Now, vascular surgery, prosthetic heart valves, retinal vessel thrombosis, extracorporeal circulation, hemodialysis. There again you can give heparin. See, basically here what is happening, you want to maintain a catheter or you want to do some hemodialysis. So, the extra from the body the blood is going out and there is circulation outside the body. So, for such things you can use heparin. Okay. Cerebrovascular disease, what about that? See, in cerebral emboli, okay, in cerebral embolism you can use. If there is cerebral emboli, you can use anticoagulants. Okay, otherwise it is not very useful. Moving on, rheumatic heart disease, atrial fibrillation. Extracorporeal circulation shown here. That was here, extracorporeal circulation. If you just missed, we were giving heparin, right? I just wanted to show you a diagram for that. Let's move on to rheumatic heart disease, atrial fibrillation. Here you want to control the thromboembolism that may occur because of atrial fibrillation, and also you want to control stroke. So you will give warfarin, low dose heparin, or you can give low dose aspirin. Okay. there is something here, the stroke prevention in atrial fibrillation trial and all that. Warfarin is more effective. Fine, so you give Warfarin. Guys, this is a wake up call. Please wake up. Pay attention here. See, in unstable angina, to prevent myocardial infarction, to reduce the occurrence of myocardial infarction, you can give aspirin plus heparin, okay, and you can follow with warfarin. Okay, warfarin is a maintenance dose as we told you. So you can give aspirin plus heparin, then you can follow the patient with warfarin. Okay. Moving on, myocardial infarction. Not much benefit has been seen in preventing any immediate mortality with anticoagulants. However, in recanalization of coronary artery by fibrinolytic therapy, it has been used. What has been used? In recanalization of coronary artery by fibrinolytic therapy, for this they have used heparin, okay, and also for coronary angioplasty and stent placement, they have used heparin. Is this clear? Coronary angioplasty, stent placement, for all such things, heparin has been used. Heparin for recanalization of coronary artery by fibrinolytic therapy, coronary angioplasty, stent placement, for all these you can use heparin. Moving on to the first one, first use, deep vein thrombosis, that is DVT, pulmonary embolism. Let us look at these two. Now, deep vein thrombosis, pulmonary embolism, PE, okay. In venous thrombi, the mainly what you will see is fibrin, okay. So, anticoagulants are highly effective here. So, that is why this is the number one use of anticoagulants, okay. Deep vein thrombosis and pulmonary embolism. In this case, the main problem is the fibrin. Venous thrombi will usually be fibrin thrombi, okay, and anticoagulants are very, very effective. Similarly, whatever we have learned till now, same thing only we are telling here. You should give heparin and you have to maintain the person with warfarin, okay. Got it? So, let us revise the uses of anticoagulants: deep vein thrombosis, pulmonary embolism, myocardial infarction, unstable angina, rheumatic heart disease, atrial fibrillation, cerebrovascular disease, vascular surgery, prosthetic heart valves, retinal vessel thrombosis, extracorporeal circulation, hemodialysis, defibrillation syndrome. Let's see how much you remember. Time for recollect. Over. Okay. Uses of anticoagulant, deep vein thrombosis, pulmonary embolism, myocardial infarction. What else did you see? Unstable angina, rheumatic heart disease. I kind of forgot this one. Rheumatic heart disease, atrial fibrillation, cerebrovascular disease, vascular surgery, defibrillation syndrome. Hemodialysis you can write for all those dialysis people, right? You will use hemodialysis, defibrillation syndrome, correct? Is that correct? Defibrillation syndrome, correct. Prosthetic heart valve if somebody has. That's also interesting, right? Not so difficult. Prosthetic heart valve if somebody has. What else we wanted to say here? Some special things were there. Recanalization of coronary artery by fibrinolytic. So you have a coronary artery, you want to recanalize it by blasting the fibrinolytic therapy. Then you want to do some coronary angioplasty, stent placement. For all that you will use. You want to place a stent, you want to do fibrinolytic therapy, for all that you will use anticoagulant. Okay. You should know what is used when Mostly everything is like heparin followed by warfarin only. Unstable angina, you will use aspirin. Rheumatic heart disease, warfarin, heparin. Warfarin is preferred here. That is the only place. Rheumatic heart disease, atrial fibrillation, they are choosing warfarin. In everything else, heparin, mainly heparin only. Everywhere it's heparin actually. Except with rheumatic heart disease, atrial fibrillation, warfarin. Okay. Did you understand the uses of anticoagulants? One take-home message from this video. So one take-home message from this video is anticoagulants are used in deep vein thrombosis, pulmonary embolism, and mainly you will use heparin everywhere except in rheumatic heart disease, atrial fibrillation, where you will use warfarin. Always give heparin maintained with warfarin. Correct? See you. Bye bye.